Hello, I'm Charles Reynolds, and just briefly want to describe with you some new research we're doing and implore you to help us find women who are motivated to help us find the answers. Women need more ways to help them with sexual dysfunction. Men have over 20 FDA-approved methods. Women have one FDA-approved drug. That's a psych drug. Now, first of all, I want to make sure you know that I think that education, relationships, I'm about to tell you about a medical treatment that we are studying with the double-blind placebo-controlled study, and I would like to ask you to consider letting people know about it who may enroll in the study. But first of all, I would like to emphasize that I do not think that any treatment that is local to the vagina or the vaginal mucosa or the labia is going to cure all sexual problems. Obviously, there's a huge relationship component. Endocrinology plays a part. Past history plays a part. And even if you make things better, there may be the need for counseling. If a woman becomes more sexual, more libido, more orgasmic, it changes the relationship. Perhaps now her spouse can't keep up with her or feels threatened by her new sexuality. Or lots of other things you can imagine that could put stress on the relationship because the woman's sexuality improves. So there's always a need for more education, there's always a need for counseling, and there's always a need to think about the whole system and how everything relates to sexual function, literally. But, on the other hand, I think to flip that and say that the genitalia does not play a role and that women might not have an etiology that affects their sexuality that involves the genitalia, I think that is probably a stretch as well. And just like in the early 1980s, we told men that 85% of them, their sexual dysfunction was psychological, and we were wrong. It feels to me like perhaps we're indicating that to women as well, and maybe that's not the case, which brings us to the present study. So the background to the study is that we, using platelet-rich plasma injected in the periurethral space and into the corpus cavernosum of the clitoris. So look at this again. So in this space between the urethra and the vagina, and most distal from the bladder, which we call the O spot, right there. Now, if PRP does what it's been shown to do in over 8,000 research papers in PubMed, then the periurethral glands, which function similar to a prostate gland. Most of the fluid when a man ejaculates comes from the prostate gland. Having the prostate full has some effect on libido in a man. When a woman ejaculates, that's where the fluid is coming from. Not that's the end-all be-all goal of the study, but that's what we have observed. And now we have physicians doing this procedure, and we did a pilot study, which I'll get to, but the other injection goes here, and the fluid, see the clitoris is all down here, hidden. Most people think of the clitoral head. The clitoris comes down on either side of the vaginal wall. So what's the idea behind the procedure? The idea is that if platelet-rich plasma rejuvenates tissue in the vagina, as it's been shown to do in multiple other parts of the body, post-hysterectomy, in the knee, in the jaw with dental surgery, in the hair, helping with scarring, improve scarring with the face. So PRP has been used to help with scarring. It's never been shown to cause scarring. It helps with scarring. All those things have been shown to be with platelet-rich plasma. And if that same thing applies to the vagina, then it should help bring new blood flow into the clitoral corpus cavernosi and into the corpus spongiosum. There was one MRI study that showed that in women who can easily have an orgasm, the clitoris is closer to the vaginal wall and the clitoris is more voluminous. But the conclusion of the study, which was published in the Journal of Sexual Medicine, the conclusion was that, well, we've shown this, there's a correlation between clitoris being closer to the vagina and larger, but we're not sure what to do about it. How do you treat that? Well, this could be one way. If we can make the tissue there more responsive, healthier, perhaps more voluminous, perhaps that might improve orgasm. There's also, we did a pilot study where we looked at what happened to female sexual distress, and it went down. And we looked at female sexual function index, and we showed orgasm improved, lubrication improved, and pain improved. So we're sponsoring this study, but I want to show you what we've published already. So we did that pilot study, but we also did this study showing that it helps with lichen sclerosis. And you don't have to be a pathologist to see that this sclerotic area, this is the same magnification by the way, the sclerotic area, this hyperkeratosis, you can see here post-procedure, the sclerosis is gone, and these are biopsies from women that we treated as part of the study. The sclerosis is gone, and the hyperkeratosis is back to what's normal instead of this hyperkeratotic area right there. So, and that's more from our study, which we published in the Journal of American Academy of Dermatology in January of this year, 2017. So we published 3 studies so far. But here's what we want to do with this study. So we're going to look strictly at orgasm. Now there's a form here beneath this video where a person can apply to be in the study. And we can't accept all women in the study. There will be a placebo arm where people get saline. So even though you're treated for free, you may not get the real treatment. If we show results, and of course we expect to, then, but there's no guarantee, but if we show results, then those in the placebo arm will be offered free treatment. It's a double-blind, and so neither the patient nor the doctor, which will be Andrew Goldstein, neither the patient nor the doctor will know whether the patient's receiving saline or platelet-rich plasma. Now, we want women that are premenopausal, because otherwise we don't know if a woman's postmenopausal, it could be that the testosterone that she's taking or the estrogens that she's using could be changing things around. And so we want to see what happens just with this procedure with no other confusing variables. We want women who have preferably no pain, because that can be a variable. Even though we've shown that this procedure works well, anecdotally, with many women we've had respond and their pain get better, we prefer women who have no pain and who do have distress. So having sexual problems to the point of distress, and someone who can travel to the Washington, D.C. area 3 times over a 12-week period. And please, if you can't, please don't apply, because, you could apply for a future study, because we'll use this list for future studies, but just understand that we want you to be willing and able to travel. Now we're going to pay for blood testing, for lab testing. We're paying for the procedure. This study is costing the price of a nice house. This is not sponsored by a drug company, because there is no drug involved. The patient receives their own blood injected back into their body the way the athletes and the veterinarians have used to rejuvenate damaged tissue to the knee and other parts of the body, the back. There's double-blind placebo-controlled studies showing it helps in the back. So rejuvenating other tissues with the person's own blood, we're just applying it to the vaginal tissue to see if that increased blood flow and rejuvenation and responsiveness to that tissue helps. So I hope you'll let people know who may be having problems with orgasm, to let them know that this study is going on so that they might apply. There's other variables we look at to make this study as clean as we can make it. This is needed. Women need better treatments. This is expensive. This will give us profound answers. It will not make the need for counseling go away. Every other therapy that's out there will still apply, but this could make the tissue more healthy, more responsive, so that all the other therapies, including psychotherapy, sexual counseling, Kegels, sensate therapy, all the things that people do that work, they will work better, we think, if we can help the genitalia respond better and more healthy. So I hope you'll pass the word to people you know, and consider applying yourself to participate. If you don't participate in this study, don't be discouraged. There will be other studies. I guarantee there will be other studies, multi-center studies in other parts of the world. And I thank you for your attention. If you have any questions, feel free, please, to contact us. Thank you.